Hello, good evening. Bristol Childrens Hospital is to reduce the number of heart operations it carries out after a formal warning over staffing levels. It's also been served with an improvement notice after failing to meet certain safety standards. Here's our health correspondent, Matthew Hill.
7-year-old Luke Jenkins from Wales died after being discharged early from intensive care onto Ward 32. This was just 3 weeks after another child, 4-year-old Sean Turner from Wiltshire, died this March after he was discharged to the same ward from intensive care.
If you haven't got the staff to make the children better, don't take them. Why rush them through?
A hospital review into Sean's death says there were not enough nurses on Ward 32 and a failure to recognise his deteriorating condition. So what exactly has been happening here on Ward 32? Well, today it's emerged that the CQC issued a formal warning to the Trust following an unannounced inspection in September. In response, the hospital have reduced the number of beds on the ward by 4, creating 2 cardiac high-dependency beds in paediatric intensive care. And because it has fewer beds, the Trust has also decided to reduce its programme of cardiac surgery. The CQC also said they saw staff filed reports about their concerns over staffing levels in February before the 2 children died. My sources say that consultants were writing to senior management for the last 3 years, flagging up the staff shortages on Ward 32. What do you think of that?
Dumbstruck as what to say. I mean, they're looking after seriously ill patients, as they keep saying, and they've not got enough staff to look after them, so they're just putting children's lives at risk.
We've never pretended to have a high dependency unit. We operated a model whereby a clinical decision was made about discharging a child after surgery from the paediatric intensive care unit onto the general ward, but those children are supported by a paediatric intensive care outreach team.
Although the changes came too late for these 2 families, their fight for answers will continue. Matthew Hill, BBC Points West, Bristol.
Well, I'm joined now from our Salford newsroom by Mr. Ash Pawade, who was responsible for turning around the Children's Heart Unit in the wake of the Bristol scandal. Mr. Pawade, many thanks for joining us. First question to you, are you surprised by the outcome of this report?
No, I'm not surprised, although I'm very hurt. I warned the management about the problems in 2007 when I left. They had another report, independent report by Dr. Mee and Dr. Godman criticising them. Then there was an article in the Private Eye talking about the management culture, and now this. It's sad, but I'm not surprised. I think they're always reacting to things and chasing their tail.
Now, the hospital has had to reduce the number of operations it carries out. It says that is a temporary measure, but could it damage its reputation long term?
I hope not. I hope not, because the clinical staff is brilliant. The management need to change their culture, but only time will tell. But this doesn't bode well at this time when Bristol has just been designated as a national unit, and Jeremy Hunt has just ordered another review to look into the functioning of the review body, which designated these units.
And just briefly, Mr. Pawade, reassurance from yourself for any parents, families who have children going into the Bristol Children's Hospital?
I hope I can, but I'm not there. I don't know. But the team are still there. Okay, I'm not there, but I hope that they can revive the trust of the parents.
Mr. Pawade, I appreciate your views this evening. Many thanks for joining us.
You're welcome.
On to other news for you now, and Britain's best-known mayor was campaigning in Bristol today, but not everybody welcomed him. Boris Johnson was in the city to back the Conservative candidate for November's mayoral election. Here's our political editor, Paul Baltrop.
The Tories brought their blonde bombshell to Bristol today. London mayor alongside would-be mayor.
Here we go, that's some bump about the candidates for mayor.
All right, thank you. Jacob, wait.
Jeff Gollop there.
Wait, mummy.
He talked to anyone who cared to listen, even some who didn't want to.
I will look back with pleasure on the many welcoming committees I've had around this country. That was amongst the most vociferous. But that's I think what it shows is that there are people in this city who are crying out for change.
The man behind the Boris bike even borrowed one for a quick ride.
This is just what the Conservatives wanted. They reckon Boris Johnson is the most popular politician in the party, probably in the country. The other mayoral candidates, by contrast, have to make do with mere party leaders.
Bristol's scenic docks were also the backdrop for Labour's biggest visit, when Ed Miliband came to show support for their man Marvin Rees. The Liberal Democrats, though, picked a less conspicuous location, the City of Bristol College, for a recent press call. Some in the party reckon leader Nick Clegg's more of a liability than an asset these days, though not their candidates.
I'm proud of being a Liberal Democrat. I recognise that we've got a very difficult job, both nationally and locally, in that role.
But mostly for the candidates, the main focus is hustings, sometimes 2 a day, until Bristol votes in a fortnight. Paul Bartrop, BBC Points West, Bristol.
Now we had some news of a retirement today for the 2 times Cheltenham Gold Cup winner Corto Star. He's run his last race after a glittering 9 years in the sport. The 12-year-old is trained by Paul Nicholls